San Diego, world-renowned for sun, surf, and fun. Nearly 3 million live in San Diego County, many of them among the very wealthiest, and many of them among the poorest and neediest. It is for these people that the Consumer Center for Health Education and Advocacy was created. Legal professionals helping to solve the very real-life health access problems of San Diego's low-income community.
My wall is full of thank you notes telling us how thankful they were because they were going through the system and could not get anywhere. As soon as they called our center, they were able to get the help they needed.
We make the difference of whether a client get needed medication for serious illnesses such as diabetes and cancer, whether or not they get into treatment centers for the cancer or diabetes. We make a difference in their lives.
I recall that when we first received this proposal about funding the Consumer Center, there were some question marks in our organization about why we would be using our health dollars to fund lawyers. But after a decade of partnership with the Consumer Center, that answer is clear. These patients need that kind of support, and it's a great way to execute our health mission.
It was born out of a desire for the Legal Aid Society to work with the California Endowment, the County of San Diego, the Board of Supervisors, and Health and Human Services to make sure that our mutual customers were able to navigate the systems of care that poor people are inextricably bound to.
Since its inception, many more partners have joined the Consumer Center to improve the systems of care.
This innovative partnership is unique because it secures full collaboration and communication between advocates and the publicly funded health programs serving San Diego County residents.
The Consumer Center advocates for access to quality health care for all, including the homeless.
I'm very proud of the advocates. We work as a team to help people with housing, help them with SSI, help them with any kind of consumer law problems we have. And that's the benefit of being at Legal Aid, is that we are a multidisciplinary team.
John Sturm was on the verge of living on the street 10 years ago when he first found the Consumer Center.
I didn't get the treatment I needed, and I didn't get the medication I needed. I was denied. I filed a complaint because I didn't think it was a fair process, and I didn't think I was being treated fairly. So the Consumer Center took my case. I was able to get a more narrowed and correct diagnosis, which was my bipolar diagnosis, and I'm very grateful for that. And I'm very grateful for the Consumer Center for the help that they've given me in the past.
To help John Sturm and thousands of others, the Consumer Center must address both the physical and the mental health issues facing this population.
Their ability to help develop a new mental health calendar for the courts has really fit into the plan that our District Attorney Bonnie DeManis and the rest of us have been working on, and that is to have mental health courts in this county, and they have been a great asset to all of us.
I want to note the important work that the center has done in collaboration with other community providers and stakeholders in reducing stigma and building better awareness about mental illness in the community. The center has always been in the forefront of many community efforts to, again, bring awareness in the San Diego community.
Globally, what do we do? We make lives better for clients, and I think if I was going to summarize it, that's what we do. We make the experience of living with a psychiatric challenge positive.
Staff members and friends of the Consumer Center have been used to dramatize an actual consumer case.
Yes, my daughter needs surgery, but I don't have Medi-Cal. Can you help me?
Yes, I understand your frustration, Maria.
Unable to get an appointment with Medi-Cal in time for her daughter's scheduled surgery, her mother called the Consumer Center.
She needs surgery now. Can you help me?
This problem under the Medi-Cal rules should be treated as an urgent matter, and the process should be expedited.
The Consumer Center advocate was able to explain the situation to the Medi-Cal manager, and Maria's daughter's Medi-Cal was restored prior to her surgery.
Okay, gracias.
De nada, Maria.
This case is an example of the way the Consumer Center advocates can successfully maneuver through what seems to be a hopeless situation with the proper knowledge.
Everybody here cares very much, and we go the extra mile to be able to contact whoever it is that we need to contact and intercede for our clients to be able to obtain the benefits that they need.
Having a legal advocate behind them certainly not just strengthen their voice, but they actually get the rights for services that they deserve.
Over the past 10 years, the Consumer Center helped over 30,000 consumers in San Diego County through individual assistance and creating systemic change through effective policy advocacy.
Through policy work, we can affect so many more people, both here in the county, and because we also work statewide with the Health Consumer Alliance, we can actually affect people throughout the entire state.
So how does the Consumer Center reach those who need access to healthcare services? Mostly through collaboration with community-based organizations like Family Resource Center, senior centers, and clubhouses. We also reach out at health fairs and make presentations to community organizations and schools.
And after I explain to them, no, I'm not selling insurance, I'm actually here to advocate for you, to teach you about your rights, to let you know that you do have rights as a consumer, and that if you're paying for a health insurance, you should be, getting the services that you are paying for monthly. They are really thankful that we exist.
We found out that immigration was one of their primary concerns for the children and the families of these communities. If we can get them stabilized in their immigration status, that lessens their fear of accessing health care benefits, which in turn makes a healthier family, which stabilizes the family unit, and the students tend to do better in school.
The Consumer Center here in San Diego County was one of the first in the country to offer medical legal partnerships.
What's amazing is how well the Consumer Center and the legal assistance does aid, and my understanding is as many as 50% of those patients that we refer end up being granted benefits that otherwise would not.
The Consumer Center speaks the languages of San Diego County.
Welcome to the Consumer Center. My name is Jeanette. How may I help you?
Bienvenidos al Centro del Consumidor. Mi nombre es Mary. ¿Cómo la puedo asistir?
به مرکز خدمات لیگل اید خوش آمدید. اسم من شاهین.
Xin chào mừng quý vị đã gọi đến Trung tâm Phục vụ Y tế và Giáo dục.
Maligayang bati sa Sentro ng Panilbihan. Ako po si Christine. Ano po ang maitutulong ko sa inyo?
Staff members and friends of the Consumer Center have been used to dramatize an actual consumer case. John is 65 years old with mental disabilities that require a number of medications. When the pharmacist asked him to pay over $400 for his medications, John decided that it would be more important to pay for rent and food. John called Social Security, who referred him to the Consumer Center.
Why don't you come on into the office and we'll talk about your options. Thank you for coming in. Please have a seat.
Thank you.
Now, John, I don't want you to worry because there is a Medicare program that will pay for the prescription drugs.
The advocate realized John should have been covered by Medicare Part D. After that, John was able to get his prescriptions for $1 to $3 each. When cases like John's fall through the Medicare cracks, our Plan D advocates can catch and fix the mistakes. This improves the entire healthcare system. With 10 years of invaluable experience serving the people of San Diego, the focus of the Consumer Center has evolved to meet the changing priorities of San Diego County.
To have a bigger impact, we have to look at our clients in a more holistic way and try to bring up overall the health of the community.
Our friend John has found a whole new life and currently serves on the Mental Health Board.
Because sometimes that journey begins with the very first day and the very first step. And unless you have someone backing you, sometimes it's very hard for people to make that very first step. So again, I'm grateful.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center.
Chúc mừng Consumer Center 10 năm đã thành công.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center.
Happy 10th anniversary, Consumer Center.
Happy 10th anniversary, Consumer Center.
Felicidades, Centro del Consumidor, por sus 10 años.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center. We love you.
Happy anniversary, Consumer Center.
Happy anniversary, Consumer Center, and many more.
Congratulations, Consumer Center for Health Education and Advocacy. 10 years of transforming lives and creating positive change in San Diego County.
Okay, congratulations, Consumer Center. All right, is that enough?
That was good. I like the last one. Okay.